Hello, I'm Teresa Shen. Welcome to another episode of Teresa Clinical Reflection. Headaches are one of the most common reasons people seek acupuncture treatment. Almost everyone experiences headaches at some point in life. For some people, the pain comes only occasionally. For others, it becomes a recurring problem that affects work, family life, sleep, and even their enjoyment of everyday activities. One of the questions patients ask me most often is, why does my headache keep coming back? Today, I'd like to share how traditional Chinese medicine understands headaches and why two people with similar symptoms may require completely different treatments. From a Western medical perspective, headaches include migraines, tension headaches, cervicogenic headaches, vascular headaches, and many other conditions. In an acupuncture clinic, however, the headaches we most commonly see are tension headaches and headaches related to the neck and shoulders. Some are caused by tight muscles. Some are associated with irritation of the occipital nerves. Others develop after long hours of desk work or emotional stress. Although these headaches may feel similar, they are often quite different in their underlying causes. That is why understanding the pattern behind the pain is so important. One of the unique features of traditional Chinese medicine is meridian differentiation. Rather than treating every headache in the same way, we first ask a simple question: where is the pain located? Forehead headaches are commonly associated with the Yang-Ming meridian. Temple headaches often involve the Xiaoyang meridian. Pain at the back of the head usually follows the Taiyang pathway. Headaches on the top of the head are often related to the Jueyin meridian. The location of the pain gives us valuable information and helps guide acupuncture treatment more precisely. Once we identify the meridian involved, we can choose acupuncture points more precisely. For headaches across the forehead, we often combine local points such as Yintang, Shenting, and Baihui with distal points like Hegu and Fenglong. Temple headaches may be treated with Taiyang and Jiaosun together with Zhongzhu or Waiguan. For pain at the back of the head, Tianzhu and Fengqi are commonly combined with Huxi. Headaches on the top of the head may benefit from Baihui, Sishenkong, and Taichung. By combining local and distal acupuncture points, we aim to restore the smooth flow of qi and blood throughout the entire meridian rather than treating only the painful area. The location of a headache is only one part of the diagnosis. Traditional Chinese medicine also asks another important question: what is happening inside the body? Some headaches are related to liver qi stagnation, often associated with stress or emotional tension. Others involve blood stasis, where poor circulation contributes to persistent pain. Some people develop headaches after exposure to cold, while others may show signs of stomach heat. Because every person is different, treatment should never be exactly the same. This holistic way of thinking is one of the strengths of traditional Chinese medicine, allowing us to tailor treatment according to each individual's pattern rather than simply treating the symptom. Once we understand the pattern behind the headache, treatment can be tailored to the individual. Acupuncture is often the foundation, but it is not always the only treatment. For patients with blood stasis, bloodletting around the Taiyang region or cupping therapy may help promote circulation and relieve persistent pain. For headaches associated with cold invasion, ginger moxibustion is commonly used to warm the meridians and support the body's yang qi. Some patients may also benefit from Chinese herbal medicine, while others receive dietary advice according to their pattern. For example, cooling foods and drinks such as chrysanthemum tea or mung bean soup may be helpful for heat patterns. Traditional Chinese medicine brings these different therapies together to support the body's own healing process. One of the things I have learned through clinical practice is that headaches rarely have just one cause. Stress, poor posture, lack of sleep, muscle tension, emotional well-being, and lifestyle often interact with one another. Two patients may describe exactly the same pain, yet their underlying patterns can be completely different. That is why I always try to understand not only where the headache is, but also why it developed and what may be preventing recovery. For me, this is one of the most valuable aspects of traditional Chinese medicine. Treatment is only part of recovery. Our daily habits are equally important. Many headaches today are related to prolonged desk work, poor posture, emotional stress, and insufficient movement. For people working at a computer, I usually recommend standing up every 40 to 50 minutes, stretching gently and allowing the neck and shoulders to relax. Regular activities such as walking, swimming, jogging, or playing sports help improve circulation and reduce muscle tension. These simple habits are not only helpful for preventing headaches, they also support long-term health and well-being. Many people hope that one treatment will solve every problem. Sometimes pain improves quickly, sometimes recovery takes time. Traditional Chinese medicine encourages us to look beyond immediate symptom relief. The goal is to restore balance, improve circulation, support healthy function, and reduce the chance of headaches returning again. Healing is often a gradual journey, and every small improvement is an important step forward. Thank you very much for watching. I hope today's reflection has given you a better understanding of headaches from a traditional Chinese medicine perspective. If you enjoyed this video, I would love to share more clinical reflections with you in future episodes. I'm Teresa Shen. Thank you for spending these few minutes with me. Take care, stay healthy, and I look forward to seeing you again in the next Teresa Clinical Reflection. PhD Win Acupuncture Clinic.